This is Wednesday, September 19, 2018, Public Safety and Justice Committee meeting at 2 p.m.
All right, ladies and gentlemen, I'll ask everybody to please take their seats. I got a text from Supervisor Yeager to go ahead and start the meeting. He'll be here momentarily. So we will do that. Colin, you ready to go? Sounds like a plan. All right, I want to welcome everyone to the September 19th meeting of the county's Public Safety and Justice Committee. And these yellow cards you see being brought up are individuals who want to speak about items on today's agenda or under public comment. The cards are right over here. You can pick them out, fill them out. Our clerk will then pick them up, bring them over here, and we'll have you come up and speak as we go through the agenda in numerical order. I've got public comment. Scott, public comment. All right. And Colin, I think what we're going to do, we're just going to start by doing roll call. And as they say their names, you can record them for the record. Is that correct? You don't need to read out names? What's most convenient for you?
Just do a quorum for the voting members, which is only you at this point, or?
Yeah, we need, I assume we have a quorum. Well, we're not going to take any action items until Supervisor Yeager gets here. But we can do public comment and all the rest. I just want to get the meeting going in respect to other people for their time being here. So we'll start on this end. Sylvia, if you'll start off for us, please.
Yes, hi, good afternoon. Sylvia Perez McDonald, Director of the Independent Defense Counsel Office.
Gary Hersig, Deputy County Executive.
Miguel Marquez, Chief Operating Officer.
Jeff Smith, County Executive.
Mike Wasserman, District 1 Supervisor.
Patricia Lucas, Superior Court.
Rick Sung, Undersheriff, Sheriff's Office.
Oops, your microphone. Nope.
Try that again. Molly O'Neill, Public Defender.
Jermaine Hardy, Assistant Chief, filling in for Laura Garnett, Chief Probation Officer.
Terry Harmon, filling in for Jeff Rosen, District Attorney's Office.
Josefina Covarrubias, filling in for Dr. Michelle Jordan.
You said Josefina.
Yes.
I got it. Thank you very much. Okay, we'll now move on to public comment, which is the opportunity for anyone to speak about anything not on today's agenda. Again, submit a card. And I have 3 cards, so I will ask Deanne Powers to come forward, Scott Largent to come forward, Susan Bassey to come forward. Those are the 3 cards I have for public comment. Speak about anything not on today's agenda. Come on forward, queue up there between those chrome handrails. First person there gets to speak. And you'll have up to 3 minutes each to speak on anything not on today's agenda.
Hi, my name is Deanne Powers.
Welcome.
Good morning. Rather, good afternoon. I gave him some documents to hand out to everybody. I'm not sure if everybody got them yet. At the last public comment meeting, I was expressing my concern regarding victims of domestic violence in the court system. I had provided, today, copies of the criminal history of my ex-husband, and also some of the records that were given to the court regarding our daughter's visit to the hospital, where she requested help for her suicidal thoughts and cutting. My concern still is that victims are not being taken seriously in family court, and the children's voices are not being heard. Their needs should be put above everybody else's, above the visits with parents, anything concerning in the family court. Our children are just not being heard, and it's really to their detriment that this is happening. Again, it's been 10 months since I've seen her. My visits have been taken away since when I went to court, and I was literally punished for just taking her to the ER for her suicidal thoughts. So I'm just asking that everybody continue to please help victims of domestic violence, that we really, really need the help in family court, and it's not working. There's just something not working here. Thank you.
Thank you. Ms. Largent, Mr. Bassey. Sorry, Ms. Bassey, Mr. Largent.
I don't think Mr. Bassey's going to come here. I first of all want to make an apology. My sources had indicated that you were a member of Shir Hadash. You are not. I stand corrected. You are in fact a member of 2 Catholic churches. I have equally as many problems with that because of the Catholic Church scandal and everything that started in 2009. And our county actually prosecuted a victim who was abused by a priest. And Jeff Rosen's office, who when Mr. Rosen goes around and claims that he's a big victim supporter and that he's defending victims and he is under the jurisdiction of Marcy's Law, he's not doing that. Ms. Harmon, you're filling in today for Mr. Rosen. About 2 years ago, I reported to your office that one of your prosecutors was engaged with an inappropriate sexual relationship. The DA's name was Carlos Vega, that my sources told me. I attempted to report that to your office, and there was so much retaliation that it never got reported. I'm aware that there are prosecutors in the office that are engaged in Match.com and all kinds of inappropriate conduct. They're doing it off the radar so that their information cannot be garnered for exculpatory evidence or for public records requests. It's despicable and it needs to be addressed. I am going to give a number of documents to the clerk after I'm finished to have you copy. I copied these at 50 cents a page because of Patricia Lucas's orders. And since the county is willing to expend resources to arrest people and break their hands who try to copy records off the new electronic system that costs the county millions of dollars to transmit documents to electronic files, I'm now going to ask the clerk to use public money to copy the documents that I copied once at my expense for 50 cents a page. I'm using my public comment to inform my colleagues in the press on how to investigate this county for public corruption. I believe that there needs to be a federal intervention into what's going on in our courts. Patricia Lucas, a minute ago, when Deanne Powers, who is a victim of domestic violence from another state, was speaking, you didn't even give her the courtesy of looking. Your courts have destroyed her. Judge Takeichi took her child through a family court services recommendation. I have the transcript. It's despicable. You have been given letters. I have seen these letters. You have not investigated your judges. Your judges are engaged, as Scott Largent says, you need to put them on a leash because they're engaged in conduct that is outside the scope of their judicial immunity and authority, and you are ultimately responsible for that. This is a list of victim services that is available online. This list was updated in January of 2018. I will give you information in the court files that will show that the person from the victim services and also a county employee is now in a family court proceeding where the supervisor was engaged in an improper sexual relationship with a subordinate. His wife is now alleging domestic violence for the past 5 years. The court files show exactly why she was afraid to come forward. As she was being abused, he was managing the claims of victims in our county. I'll finish the rest on my next. You can copy all these. I need these back.
Got a lot of stuff today. Sorry about that. Ready when you are, Colin. Thank you, bud. You know, I go to domestic violence subcommittee meetings, and for like a year and a half of going to them, everybody looked down like all of you are when victims would speak. She deserves the respect to speak in here. You guys got something better to do over there? Sitting on your phone, process. This is a meeting where you all need to start paying attention. Okay, see all that? Eyes. Okay, we could work on that. Get off the computer, get off the Facebook, get off the Snapchat, get off the dating apps. Start paying attention. Ken Yeager, please start showing up to these committees on time. There's a reason Victoria's called you Yeager the Quitter. You have quit every committee that you were pretty much on involving the jail, behavioral health, or anything. I would appreciate if you could show up on time to these meetings, please. You ignored my complaints for years, okay? It'd be nice to show up and maybe look that woman in the face right there that this system failed her. I am absolutely frustrated with all this stuff. I am really fed up. I reviewed my file. You know, I had independent defense counsel out of Sylvia Perez's office, and I pulled the court copy for my Bullhorn trial, DA copy, city attorney's copy. You know, I wanted to kind of get a grasp of what really happened. Pulled my entire file, realized that they left out half of Officer Tompkins's police report. Now, they're going to come up with some excuse that supplemental narrative. I mean, they do this dog and pony show where they try to just make up excuses. I've talked with Officer Tompkins. He wanted the correct information in his police report. And guess what this part of the report is? This right here shows that Eddie Garcia, the chief of police of San Jose, is my accuser. Okay? Why was this removed? Here's another thing. Why was this report and exculpatory evidence sent over from the city attorney's office via carrier? Not electronic, the nice way they stamped it. My attorney from the IDO, he was all excited. He goes, wow, I asked him about this. I said, how did you get the exculpatory evidence? He goes, they sent over a carrier. They did it super fast. They were really helpful from the city attorney's office. Well, they probably would be because they missed an entire page. And that was the purpose of my call to you, Sylvia. Rather than hang up on me and keep praising your attorneys like they're God's gift, it's this stuff that I'm trying to complain about, okay? It's the fact that we get stuff going on here. Remember, I'm trying to think what the other, there was something else. It just blew my mind away. You are all a failure, okay? You really are. And when's this dog and pony show going to go on with the court that you canceled over there at City Hall? It should be in this chambers right now. I want to address the court system. I want to address the people in power. And why would you even want to set something up over at City Hall, Patricia Lucas? It should be right here for the public to chime in. We're all very upset, okay? And this is not okay. And I've been filming all of you discussing this. And so you know, Jeff Smith, I was up in your office, okay? I've been filming you guys explaining this stuff. Nobody's going to do anything. I don't want a civil lawsuit. I want somebody higher up like the Department of Justice or the Attorney General getting involved. I don't want a settlement. It's not about the money. It's about what's right and wrong. And
That concludes our, Scott, you know your
megaphones
time's
now
up.
are provided with Happy Meals.
Scott, thank you.
Start arresting children. Thank you.
That concludes the item number 2, public comment portion of our agenda. We move on to item 3, which is the consent calendar. And Supervisor Yeager, I would suggest that we add items 4 and 5 onto our consent calendar, which currently only includes item number 10.
I agree with that and would make that motion, Supervisor.
Thank you. I'll second that, but before we conclude and take that vote, I've got speaker cards for 4 and 5. Any committee members with any comments to make on items 4 or 5? Seeing none, we'll go to public comment. Ms. Bassey, you have a card submitted for item number 4. If you could please come up. And I've got a card for number 5, but no name on it. Is this Mr. Largent, Ms. Bassey, anybody else?
That's mine. I have 4 or 5. I added several items.
Yours is 5 as well?
Mhm.
Okay.
I'm going to talk on number 4, on the gangs and the police, the sheriff report.
Excuse me 1 minute, if you could stop her time. And we're in the consent items, so you'll have a couple of minutes to speak on both items so that you know in total.
Okay.
Thank you.
So in your packet today, we're going to talk about a gang, and it's a gang of lawyers. It's a gang of government lawyers who are currently being investigated for what they just did with the county council related to John Hirakawa's election. And the courts intervened. It's interesting how easily the courts will let you violate a rule when it's convenient to the people in power that you want to violate the rules, and they don't let them do it when they shouldn't. This is despicable. There are gangs, and they don't look like they used to in Chicago or in Gilroy when I was raising my children, and Stuart Scott said things in the record that made people get gang enhancements because he was eliciting the emotion from the public. Stuart Scott got in trouble for that from the Ninth Circuit Court. And the reality is our gangs are different. And today, they are gangs of attorneys, private and government lawyers, and in your packet, you will get information on a 638 and 639 appointment of referees. Prior to 2003, the state legislature made the courts report how much money people were paying private judges. That mandate went away in 2004. Patricia Lucas has received multiple complaints in one of her letters to me about a referee who took $100,000 from me without an oath and without a fee agreement is in that packet. That same referee has harnessed numerous other cases where he has made millions of dollars with attorney Bradford Baugh. Patricia Lucas has done nothing about it. They've violated rules, they've violated orders, they violated a number of other things, and Patricia Lucas hasn't done anything. I'm encouraging the Sheriff's Department to start considering that gangs look different these days. And Rick, I would appreciate if you would pass that on to Lori. We are prepared to bring a report and a complaint to the Sheriff's Department about a gang of lawyers that is running around in high-asset divorce cases in Santa Clara County, and it involves improper governmental activity, and we need to file that report. Thank you.
Scott, I don't have a card, I assume. You want to speak on 4 or 5?
Yeah, about gangs. Great, thank you, thank you. I went to a lot of meetings involving the gang activity here in in our county, and I'm all for it getting cleaned up. And I'm all for that other gang that we have here. Like Victorious would say, at first I kind of got offended that he would say this, but it was illness spreading germ attorneys. I mean, he was dead set. That was the gang that he didn't want in our county. And, you know, I mean, I'm kind of, you know, not necessarily getting off topic, trying to get as much time in here to say what's going on at this dog and pony show. No one's really showing up ever here. This I have said, failure, failure, failure. I would love to have had the right spot to bring my concerns forward. Mike, I tried to go upstairs. I don't know if your staff let you know yesterday. Every time I've ever gone in to try to talk to you, not necessarily, I understand you're a busy man, but staff, sending out somebody to talk to Scott Largent in the lobby. I have been shut down every single time for the last 2.5 years. And I hope you do realize that. Now, Ken, we might have our issues. Your staff's been great to me, so I'll just go ahead and let you know that. They have treated me with dignity and respect. They have come out. They're professional. I enjoy that. My staff, I just don't know what's going on. You might want to have a talk with them. What I did is I filmed each one of your staff members up there yesterday, asking them what to do about what happened with that report. Okay? Now I want to take it to the court of public opinion, because you all are not going to do anything about this right now. Civil suits, no way. Justice. I want justice on this stuff right now. Now, which one of you is going to start launching that right there? This is corruption from the top right here. And these people aren't happy, so we got that other gang to clean up. Thank you.
Thank you.
I'm going on number 5 now, which
No,
is
you
the,
spoke. It's 2 minutes total for items on consent. That's what I was explaining to you.
it's regular agenda item. That's what it says on mine.
4 and 5 were moved to consent.
I had speaker
And that's-
cards in before they were moved
that's-
to consent.
Okay, I'll give you 30 more seconds to wrap up some thoughts on 5. 4, 5, and 10 are on consent. They were moved by motion by Yeager, seconded by Wasserman.
Okay, on number 5, you're going to receive a report from Employee Services Agency. Make sure you look in there to see that when they moved Silicon Valley Faces into the District Attorney's Office, they didn't do background checks. In your packet today, your Supervising Claims Division person has a bankruptcy, a number of other civil filings that are in your court files, Patricia Lucas, and he also has a domestic violence case, and all of that is pending. None of that came up in a background check before you put that man in charge of handling money and where he was engaged in an improper sexual relationship with a subordinate.
All right, that concludes public speaking on items 4, 5, and 10 that were on consent by motion by Yeager and second by Wasserman. That passes unanimously. We now move on to item number 6, which is to receive a report from Social Service Agency, Department of Family and Children's Services. And I have one speaker card for that, but we'll do that after the report. Welcome.
Hi. Good afternoon, Supervisor Westman, Supervisor Yeager. My name is Laura Brunetto. I'm with the Public Health Department. I'm our Public Health Nursing Director. And I have Tammy Bowe to my left. She's our Public Health Nurse Manager who oversees the nurses who provide this service.
Thank you.
So I just wanted to give you some highlights. You have the report in front of you. Wanted to give you an update on the status on monitoring the psychotropic medication use for children in foster care. And as you are well aware of, in May of 2015, the board did put forward an inventory item to add a public health nurse who would be monitoring the psychotropic meds. This was very forward-thinking because in September there was legislation that passed that required this monitoring of the psychotropic meds in foster care children. However, there was no funding attached to it. So it wasn't until 2017 that we did receive some state allocation that allowed us to be able to add on an additional half a public health nurse. So our goal is really to ensure that children are receiving the appropriate medication that are appropriately prescribed for the optimal effectiveness. Approximately year to date, the public health nurses conduct monthly phone calls. They conduct with the caregivers for the foster care children and youth in out-of-home placement. And partly what they do is they compare what actual medications are taken with prior approved medication plans. Some of the measures of our success have been improvements in the evaluation of the medication efficacy and possible side effects, an accurate record of prescribed psychotropic medication and actual usage, and an increase in collaboration and response between the social workers, caregivers, and prescribed physicians. Now, with the 1.5 positions that we have, there's follow-up with each child on psychotropic medication to follow up on their lab work, follow up with their psychiatrist, on provider appointments, side effects, other medications that may impact effectiveness of the drugs. And an important contributor to this success has really been close collaboration with DFCS and also behavioral health, Dr. Ho and Dr. Florenza, and the pharmacy. All this has allowed for the nurse to quickly problem solve, address barriers, link the youth to services, and to assure continuity of services. The public health nurse provides this information with the social worker who then reports it to the courts. And an important additional component of this has been the work that we're doing with group homes. Some of the children in many of the group homes are followed by a psychiatrist provided by the group home. The public health nurse has addressed this issue by attending meetings with the psychiatrist and the case conferences. As stated in the report that you have in front of you, the children and youth are also monitored on the frequency of seeing their provider. As of June 2018, a total of 128 children and youth were currently being monitored by the public health nurses. In addition, 6 other youth were part of the juvenile probation department that they were following. This is just one moment in time. The caseload varies depending on new cases coming in. Changes in medication usage, adoptions, children, youth aging out, the status from foster care to family maintenance, and other reasons. So the tables in the report actually show the number of the medications authorized. And one thing to take note of is that sometimes a prescriber will ask for multiple medications to be authorized. In the event that one or more medications don't have are not working for the child, and so that there's other authorized medications available. So the provider will then make a decision on which one to prescribe, and which may include one or more of those medications. So now the public health nurse, through collaboration with the provider, is aware of what medications were prescribed. The nurses have made over 400 monthly contacts via phone and email for care coordination. The nurses have followed up conversations with the youth, their caregivers, social workers, families, as well as behavioral health and probation department staff to understand the behaviors that are being exhibited, as well as the potential side effects. Check-ins with the youth, their caregivers, social workers, juvenile probation officers, and families to oversee potential side effects and to connect the youth with behavioral health staff as appropriate. In addition, our staff, as well as our public health nurse manager, have participated in several state work groups that have been developing benchmarks, updating job descriptions and job duties for these public health nurses. We've also been actually contacted by the state to work collaboratively on developing some statewide training materials. And then in addition, the state is working on updating the CMMS, CWS system, which is the data collection. And the intention will really be to have a better system that will enter information to be able to generate reports. And this will provide us with more quantitative metrics. We're happy to answer any questions that you have on the report at this
Laura,
time.
Tammy, thank you both very much for being here. Supervisor Yeager, I've got 2 speaker cards. Hear from them, and then, or would you prefer
No,
to
that'd be
speak?
fine.
Okay, thank you. Ms. Bassey and Ms. Powers, come on forward on item number 6. You'll have up to 2 minutes to speak on this item.
Regarding the medication given to foster youth care, what's happening now is that when it pertains to family court, our daughter, well, now that she needs medication, she's been given medication now from father, but I can't get any copies of it. So the way that the orders are being written against non-custodial parents, we don't have any access. So I don't know what kind of medication is being given to our daughter or anything. So I'm wondering if anything could be done about that, even though apparently they can get, all the medications that go through with foster care system, but I'm talking about family court. There's no way of knowing what kind of medication she's getting, so I'm wondering if something can be done about that. Thank you.
Thank you.
Thank you. I'm aware that this report and efforts to deal with psychotropic medications in our youth in foster care came about because of the excellent work done by my colleague Karen DeSaw, who was with the San Jose Mercury and is now with the San Francisco Chronicle. Her work continues, and she is investigating this area. The fact that we're spending this amount of effort on addressing if we're doing the right thing for children, 128 children in foster care, is great because of Karen's work, but we're missing the boat on these children who are in our family court. These parents who are abusive are putting their children on drugs. I have monitored many of these cases, and these judges, for no reason at all, when one parent has no criminal background and no reason, and like in Ms. Powers' case, she was the victim. She now doesn't have legal or physical custody. She is struggling to watch her daughter, who is depressed, who is reaching out for help, and no one is helping her. And the family courts are making her a prisoner, and we don't know what they're giving her. And she's been out on social media saying that she's being given medications. That's not right, people. That's not in the best interest of children. Judges who have the discretion in family court to make these orders have to be monitored better. Patricia Lucas, you're failing our children. You give the dicta that it's in the best interest of children. There is nothing you are doing that is in the best interest of our children. These cases and these parents need to be monitored. You are not a doctor. Much like you tried to pretend to be in Kathy Fike's case when she was groveling around on the floor for her heart medication and you thought she wasn't credible. It doesn't matter if you think these parents are credible. They have a right to speak up over the medications being given to their children, and no court in the world should be allowed to prevent that. Thank you.
Supervisor Yeager.
Yes, thank you. Thank you for the report. I've been working on this issue with public health for a long time and made great strides, so thank you for all of that work. Is there any, are there any issues involved when we really don't know what medications are actually being taken as opposed to those that are being prescribed? And I can understand why someone would prescribe a certain amount and then the options then are there to decide which medicines to actually then give to the patient.
I can let Tammy comment on that more, but maybe I might have provided some confusion. So one of what happens is the judges, there are more medications that are approved, but the nurse is tracking the medications that are actually taken, prescribed, and being taken.
Oh, okay.
Yeah.
Thank you. I was a little unclear
And
about
yes,
that.
that's correct.
Thank you. And then I noticed that we've hit the 90% number for the youth that are regularly seen by their physicians. Is it just almost impossible to get to 100% for any number of probably good reasons, or are we still striving to have that to be our goal?
I think one success as part of this program and this really collaboration with behavioral health has been that behavioral health has actually changed their, our behavioral health department has changed their policies on the frequency of how often the children do come in, but not all the children are within our system. And so I think the nurses are working with those providers to try and encourage that, but there is, other medical providers or medical groups have different standards of how frequently they're visiting. Are there other reasons, Tammy?
And that could be possibly because the youth had declined the therapeutic services or the follow-up with their prescribing physician as well.
Good. Thank you.
Thank you. Committee members, any questions on this item? If not, I've got one for you, please. On your package page 16, where you've got a couple of charts, and I appreciate charts and numbers. It's one of my favorite things in life. But I see you nodding, Javier. What I would like in the future, assuming we didn't miss it somewhere in here, the numbers that you show for the period January through June, the first half of this year, I would love a comparison, say, to the same period a year before.
Sure.
Just to kind of see which way we're trending.
Sure.
So thank you very much. And with that, Supervisor, we'll consider this report received.
I'll make a motion to receive the report.
Received, firsted and seconded. Thank you very much. With that, we move on to item number 7. And again, Laura and Tammy, thank you very much for your report. Item number 7, the aforementioned Javier will be giving a report, Office of Reentry Services, relating to an update to the Adult Reentry Strategic Plan.
Good afternoon, Javier Ayer with the Office of Reentry Services, along with me, Natalie Lee from the Office of Reentry Services. So we're just going to put the PowerPoint presentation.
And before you start speaking, committee members, if you're not here often, to the right of your screen is a box with 3 buttons. If you press the bottom input button so the blue light comes on, you'll be able to get the PowerPoint on your screen. When the PowerPoint's concluded, you press the button to go back to the computer monitor.
So the first slide here is just an overview of our mission and our vision. And so we really want to emphasize this update to the public safety and justice.
Excuse me, Javier, I misspoke. You want the blue light off, which I know all of you with college degrees that you figure that out. Thank you.
So this is one of our routine updates to the public safety and justice in terms of our adult reentry strategic plan. So we've been working with our plan that has been in place since 2012. And so we're working with the Reentry Network governance team to update that plan. Part of our guiding principles is to always make sure that clients are focused. And as we move along this presentation, we're trying to create a new continuum of care for our clients. Just a quick update. So we've been working with 4 working adult working groups. We hired a consultant to have some focus groups. We've been doing some strategic planning, and we did a draft update to the Reentry Network last month. And so we're just giving you an update, and our plan is to have a final and implementation plan to the Reentry Network in December. Then we'll have one final review from Public Safety and Justice before we take it to the board, so that our hope is to have something in place by July 1st of 2019. So as I mentioned, we've been working from our 2012 strategic plan, and so our focus is just to continue with some of the service domains and then identify new services that we could implement for our clients. Part of our strategic plan is to continue to enhance system collaboration. And just one thing I want to highlight on this slide is our community awaiting placement supervision. So that's something new that we're working with probation, pretrial, the sheriff's office, behavioral health, Office of Supportive Housing, and custody health, and of course Superior Court, to identify folks from the JAC list, the jail assessment list, to make sure that when they are released from custody, while they're waiting for placement, they're receiving other services that we could provide through the reentry services and the reentry center. So lessons learned from CAPS is something that we want to enhance as we move forward with the new strategic plan. This slide just identifies some preliminary findings and challenges. One thing that we asked our consultant was to identify the multiple screening and assessments an individual may have to undertake over their time from being in custody through reentry services. And we were able to identify 14 different screenings and assessments. So that's someone that comes into jail, is assessed and screened by the sheriff's office, custody health, behavioral health, probation. Once they're released, they're reassessed by behavioral health, reassessed at the reentry center from Office of Supportive Housing, social services in terms of their needs, reassessed in many ways. And then once they're sent off to a community-based organization, they may be all reassessed again and screened. And so now we want to look at all the different assessments and screening tools and figure out what we could do to avoid duplication of screenings, and then also to have some common ground in terms of what information we could share along with partners. Another thing that I want to highlight here is our work with peer mentors. And so something that we strive to enhance is making sure our clients receive some peer navigation in the community. And there are some limitations as to what type of peer mentors can go inside custody to work with our clients before they're released. So that's something that we're working with the Office of the Sheriff. This slide just identifies some service access points. So one of the questions that Reentry Network asked us is, should we have multiple centers or multiple areas where we could provide services or have it all in one place, such as at the Reentry Resource Center. And a lot of our community-based organizations have their services out in the community, so that's something that's easily available for our clients to access. What we try to strive at the Reentry Resource Center is just to provide the basic needs, access to social service benefits, access to assessments and screenings from behavioral health, access to getting the VI-SPED data, which is a screening for Office of Supportive Housing, and then primary care to the mobile medical unit. And of course, our center is where clients report to probation, parole, or the sheriff through CASU. And most of all of our services are scattered throughout the county to make it easy for our clients to access. Finally, as we move forward to the update to the strategic plan, we really want to focus on these 4 categories, these 4 strategies: serving the client, strengthening collaboration, sustaining public safety, and steward operational excellence. So we know we have a lot of work to do. We are refining our systems. We're putting in place new electronic communication through our referral tracking system. Both the Office of the Sheriff and Probation are enhancing their case management systems. And so as those come online, we want to look at best practices, how we could share information. But the end goal is to serve the client. We will be coming to the board in the future in terms of allocating funding for services, part of our request for proposals for 2020, and also looking at case management services for our clients. And we've been working with the sheriff in terms of gender responsive opportunities for women program and how we could enhance those services. So with that, I'm open for questions from the committee.
Thank you, Javier and Natalie. Thank you both for your report and your information. Supervisor, I've got a couple of speaker cards on this item. All right. We'll hear from them. And then committee members, if any of you have any questions on this, please turn on your light. Judge, we'll come back to you in just a minute. Mr. Largent and Ms. Bassi.
Hi, good afternoon. Grumpy Scott Largent today. I enjoy seeing graphs and charts and things being transparent and kind of seeing what's going on. I do think the Reentry Center is, you're doing good work, bud. You really are. I enjoy this. I kind of like seeing success stories, and I do understand that you have to kind of be a felon, you have to be a criminal. I just would have liked other options when I walked over there. When I was scared, cold, a couple days sober, I was kind of knocking on. I didn't know where to go. So, I mean, is something going forward if there's other options for people that are not on probation or parole? So, I'll cut it off. So.
Thank you.
As I mentioned at the outset of the meeting, my goal in life and my profession and everything else is to inform the public, to make sure I get the facts right, to make sure that my colleagues who don't make a lot of money, don't make nearly the money like Jeff Rosen makes, have the tools that they need to investigate their government and to investigate their local community. And reporting locally is my new mission in life. I believe firmly that we need to report locally. So I'd like to speak to my colleagues in the media and to citizen reporters who are looking to investigate their government. A handy tool that we have is all the information provided by the county on the Board of Supervisors site. And as Mr. Scott Largent, who I consider a stellar citizen reporter, pointed out to me this week, that also on your county website puts the attendance records of people who are assigned to commissions. Patricia Lucas, you're assigned to seat number 4 on the Reentry Network, and your attendance record is 14%. We will often hear my colleagues in Washington, D.C. talk about the attendance records of Congress, and we know that the public is waning in their confidence in our public government in Washington. The same needs to apply here locally. Jeff Rosen's attendance record is 0 on Reentry. These are numbers that are easily available to anyone from the public. They should be looking at them. If these are issues that are important to our community and that we're putting all this taxpayer money into on the reentry, then we need to make sure that the people who are assigned in these positions and appointed by supervisors to sit on these various commissions, councils, and committees, that they attend. Thank you.
That concludes the public speaking portion. Supervisor Yates, I've got Judge Lucas with a question or comment.
A comment, Mr. Aguirre. I know that you've been working very closely with Judge Vanessa Zecker, who's the supervising judge of our criminal division, on all the issues that relate to your work. And as statewide chair of the presiding judges group, I have seen a lot of what goes on in other counties. And I'm always very proud to come back to Santa Clara County. And the work that you have done in the Reentry Center is really something that the whole county should be proud of. So my gratitude for that.
Thank you. Thank you very much. Supervisor? No? No comments? No? All right. We will, with your consent, Supervisor, we'll...
Make that motion to approve.
Item 7 has been motion to approve as received. I seconded. That one's done. We move on to item 8, and we continue. Javier.
We're just waiting to get the PowerPoint presentation up and running. So,
yep. And if you want to see it, press the button that doesn't cause a blue light. There we go.
So with me today is Chad Martins. He'll do the presentation, but I do want to acknowledge staff from Behavioral Health Services. They're here if there's any questions on behavioral health services.
Good afternoon. So this is the second semi-annual report, so it's kind of just covering the whole fiscal year, and these are just some of the highlights from the report, which I believe you have in front of you. So we've seen this before. Nothing much has changed since the last time we reported it. Since October 2011, as of June 2018, just under 8,000 individuals have been released into Santa Clara County, and there have been 9,165 reentry events under AB 109. But it's been pretty consistent since 2015. Demographically, this population hasn't changed much over these last few years. It's still majority male by far, majority Hispanic. It's an aging population, so that 18 to 24 category is getting smaller and the others are getting larger. And then city of residence, most of them, the realignment clients are coming from San Jose, according to their address listed in CJIC. So this is the AB 109 probation caseload, which are the PRCS and mandatory supervision clients. As of June 2018, there were 1,598 individuals being supervised, and 68% of those were active as of that day. And as you can see from the chart there, PRCS has a higher rate of bench warrants compared to the 1170 mandatory supervision population. And then the third supervised population are the custodial alternative supervision participants. During the fiscal year, there were 107 entries into this program and 132 dispositions or exits/outcomes. So 73% of these dispositions were successful. And if we're looking at new law violations, there were only 2 and only 2 absconded. So we're seeing positive outcomes here still. These people are finishing their sentence in the community without too much trouble to the public. So in terms of the Reentry Resource Center clients, this fiscal year, or this last fiscal year, we saw just under 22,000, or we had just under 22,000 visits from over 5,000 unique clients. We're seeing over 5,000 clients each year the last few years. And as you can see from the graph, it's pretty consistent quarterly. And the top requested services are the same as they usually are. All of those were requested by at least 1,000 individuals over the fiscal year. Housing, again, hasn't changed much since the last time. About a fifth of our clients are homeless when they come into the center, so we're working on just looking for opportunities to expand capacity and get these people housed, especially the highest risk individuals. And then just under 700 housing screenings were conducted at the center. Those are the VI SPDAT screenings that are used to place them into the queue for the programs. Now in terms of unemployment and educational attainment, again, it hasn't changed much. The vast majority are unemployed. About 62% are actively looking for work and unemployed, so those are the ones we're going to be targeting. and as Javier mentioned, we're looking for more education or employment opportunities in the next RFP. And then, so for educational attainment, a lot of our clients don't have a GED or high school diploma, so that's an opportunity there, as well as the higher education.
Chad, can I just stop you for a second? Maybe go back for a moment. We all know that the unemployment rates are very low. Is it that a lot of sort of those entry jobs, whether it's in restaurant or Target, are not going to be suitable for some of these clients, or is it just sort of informing them or finding the right match?
I think it's a combination of things. Part of why it's so high here is when they register, they're just coming out of jail, so it's not likely they're going to have an employment opportunity set up. But as we see going forward, they struggle to attain employment, and that's likely because of their criminal record, or maybe like for the custodial alternative supervision program, some of them are reluctant to get employment because they'd rather finish this program first and rather than have to deal with that. So there are different issues depending on which specific reentry clients you're looking at. But overall, I think it's the background and just the struggle to kind of do all this while they're still trying to reenter the community within the first few months.
Are there some companies or labor groups that you work with to see if they have job postings coming up and seeing if there's a connection?
Yeah, our operations program manager gets a variety of employment emails that he forwards to staff, which they forward to clients. So we do kind of do outreach in that way, and we work with our contractors. I forward those opportunities to Conexion, which is a day employment center, and they'll case manage the clients. So we do what we can to spread the word whenever we find these opportunities, and there are a ton of job fairs and stuff. I don't know. Is there any?
Another area of employment is the county of Santa Clara. So we've been working closely with San Jose City College to offer a certificate for peer mentors. And so we just have a class right now of, I think, 26 students. And so we're hoping that those individuals can then apply to county jobs. So we've worked with ESA to then provide them with opportunities to see how they could apply to entry-level positions here in the county.
Great. Thank you.
Okay, so moving on to the South County Reentry Center, this was moved from San Martin to Gilroy mid-year, and as you can see, the visits have kind of spiked since then. We're hoping to see that continue. We're working on outreach, working on getting the reentry clients of South County familiar with the center and aware of it. Over the fiscal year, they had 428 visits to the South County, both in San Martin and Gilroy combined. So moving on to the service providers, social services is still our most utilized partner. They helped 1,652 households get benefits this fiscal year. And as you can see from the graph, they're actually increasing their output. So that's a good sign, and they're doing good work. And then we get to the medical mobile unit, which was mentioned in the strategic plan. The vast majority of these visits are for the doctor, but they also have access to the psychiatrist and community health workers and social workers who case manage them if they're high risk. So over the fiscal year, 1,214 patients were served on this bus or van that they access at the reentry center. So for the behavioral health team, this is the unit that screens clients for substance use and mental health treatment needs at the center. During the fiscal year, they served 2,489 unique clients, but as you can see from the chart, the numbers are kind of falling quarterly, so we're working with them to figure out the exact reasons why. Two of the main reasons right now that we've been able to identify are staff shortages in Q3 and Q4, as well as changes in operations. They're changing to a more clinical team rather than a general needs team, so they're doing less. Office of Reentry Services is seeing more of the general clients, while behavioral health is just focusing on the ones with clinical needs or who are specifically asking for clinical. So that could explain part of the drop, but we'll continue to work with them and really make sure we're maximizing capacity. So for substance use treatment services, this slide is only showing those served through the AB 109 cost center. There are clients served through Medi-Cal. So from that cost center, 1,038 admissions during the fiscal year. And as you can see, it's also declining. So we also need to be working with SUTS to make sure that we are keeping those doors open for that cost center and maximizing its use. For mental health treatment services, we had to do the data a bit differently. So what we did is we cross-referenced all of the reentry clients and saw who got service after they registered as a reentry client. So those numbers are going to be higher. It's coming from multiple cost centers or locations. And the most common is outpatient, as we've seen before, by far. So Office of Supportive Housing has the rapid rehousing programs and the emergency assistance program. So as you can see from the left, there were 51 individuals housed through the rapid rehousing, and then 24 housed through the exceptions program, and 10 housed through the jail diversion. And then the EAP, these are basically assistance checks that are cut to a household. So about 200 households were served during the fiscal year, and the most common way they were served was through rental assistance, which is a subsidy to help them pay their monthly rent. Last but not least is the Public Defender Office. They are overseeing the reentry expungement program. So just under 3,000 individuals contacted them during the fiscal year. Out of those, there were 945 individuals who were screened. And then out of those who were screened, 61% were eligible. And about 96% of those who are eligible, or at least the dockets submitted to the court, are granted relief. So if you're deemed eligible by the paralegals, then you're more than likely to get something cleared from your record. So again, they're seeing a lot of people and helping a lot of people get employment and cleaning the records up. And that's it.
Chad, thank you very much. Javier, thank you again. Committee members, we've got a couple of speaker cards on this item. Mr. Largent and Ms. Bassi.
Hi, good afternoon, everybody. I hear you guys talking more about the housing, and as far as the mentally ill and the homeless, I participated in moving the homeless encampment over here. I've gotten to know a lot of people in our homeless community, a lot of people from all the churches, the pastures. They're all good people, and they're just fighting to kind of stay alive. It was kind of neat, having articles like this and the community getting together. We can't keep kicking these people down the curb. Our union here, of course, stepped up to the plate, provided them a chunk of property on the side of the union hall over there. When it starts raining, that is going to be like mud wrestling over there. So, that's not going to last too long. It's nice that they offered it, but don't we have facilities in Fleet? Can't we pull some strings and pave the lot over there? Can't we clean up that third world country over there underneath the airport? There's a lot of stuff that's just not getting done. And none of these people can succeed if you don't have a place to go to. And going to a place, they have pallets with a tent on there. That is like a home. There is nothing wrong with that right there. And the county failed these people again. And it was nice to get out there. It was nice for Sheriff Smith to be out there. I was actually quite impressed with that. And I thought it was a really great thing to take the work release program inmates and get them out there to move stuff, because they were kind of getting involved. It was like, they had smiles on them. They felt good, like they were doing something for the community. And a couple old timers out there, it was kind of neat. A couple of the inmate guys are standing over there, and the old guy goes, hey, what do you think? The thing's going to lift itself? You got to, start moving. And that's kind of how I grew up. Like Grandpa slapped me in the back of the head saying, hey, you need to get over there, open that door, you need to pick that up. And maybe some of these people just don't have those opportunities. And maybe it's great we could have them help move encampments rather than take everything everybody owns. And we're currently gassing the poor here in San Jose. So thank you.
Thank you.
I want to thank you for the report. And Patricia Lucas, it was nice to see you comment on your 15% attendance record. In that report, you discussed that the Public Defender's Office is in charge with the reentry. From the grand jury report of 2016 and 17, we know that this county outspends with our district attorney's office at $135 million, the DA's office and the IDO office quite significantly. In fact, with the IDO office, we only pay attorneys $129 an hour. Jeff Rosen's now making almost $400,000 a year plus benefits, and he has the third highest, largest district attorney budget in the country. In the state, we need to start looking at those numbers. We need the press to start covering this issue. And we also need to start looking at what we're doing in our family courts to people who come in with high value asset divorce cases, and the judges are not consistently doing what they're supposed to be doing. Contrary to what was pitched to the public during the Persky recall, judges are not following the law. They're not leveling the legal playing field, and lots of women who are not in control of the community assets are being criminalized. They're being forced to represent themselves in complex divorce cases regarding their property and their support. They're being imputed for income that judges have no authority or ability to make, and they are spitting the women out, primarily the women. They're spitting them out, and a lot of these women are becoming homeless, leaving our community, or they're being put in our jails. And that is putting an undue burden on our county. You people have to start looking at the connection between the family courts. Patricia Lucas, you have to start looking at what you're doing, and you have to start communicating to the county instead of just simply relying on judicial immunity that you think that whatever you're doing is right, because it's not. Thank you.
Supervisor Yeager. Sylvia.
I just had a few questions for Chad. Sorry, I can't see you there. In a couple of the slides, this is on page 76 of my packet, when we're talking about the substance abuse treatment services and also the behavioral health treatment services, it appears that there were some decrease in the numbers, you know, in FY18 quarter 2 to quarter 3, there was a decrease in the number of clients, AB 119 clients that were served. And I understand that Medi-Cal is also, it's a different category, but is there an understanding there also of why there was a significant decrease?
As far as I know so far, I think part of that is because, you know, less people were seen by the actual unit at the reentry center who refers people. I can't comment on the other issues that might be causing this. We are working with them to kind of delve into the data and look into it. But one thing to keep in mind is this is the AB 109 cost center only. So due to data sharing policy changes, we've kind of had to quickly adapt to how we do this report. So hopefully next report will have a more thorough method. But for this cost center, it's really, I think, just a small amount of the clients who actually are being referred, because a lot of them are billed through Medi-Cal. So they're showing up in Unicare, getting the services, but they're not in the center. So it could be maybe more individuals are now enrolled in Medi-Cal as well. I'm not sure. But I do know that it's a large percentage of the drop is probably because less people were able to be seen at the reentry center due to the staff shortage.
Okay, and is that also a potential explanation for the drop in the behavioral health treatment services, indicated between FY quarter 3 and quarter 4? Obviously, you know, somehow our population hasn't gotten mentally health. You know, they still have the same mental health issues, but that decrease could have also the same explanation?
Yes, and I did speak to the program manager about this, and he believes that the main reason is a staff shortage, just because they weren't able to do as much work as they usually do with less staff.
Okay, and I guess a related question is, and Javier, I agree, you should be commended for the tremendous help in work you've done in this area. But as you're preparing in your strategic plan, and as you know, I've seen you in so many meetings, there's a lot of changes, including 1810 and all of this. The needs, like the more success you have, the more indispensable you are becoming to linking criminal justice folks to services. And as, for example, we're talking about mental health diversion, and we really want to figure out a way of connecting that in terms of capacity, especially in the mental health arena. How do you envision incorporating that potential need in that plan? Obviously, there is that potential that as you're planning through, there are so many changes, including the increased demand for your service.
So I think our success is contributed to the extensive collaboration we have with all of our partners at the Reentry Center and then in the community. We're very fortunate that we have committed staff and partners to do that. Regarding the capacity issue with behavioral health services, so we presented to the reentry network in August in terms of, as we built our strategic plan, how is that taken into account the behavioral health capacity. So on the mental health side, they are expanding services. We're looking at opening Mio Right and other centers to expand the mental health services. So on the substance use treatment, they're looking at expanding the outpatient program to meet the demand. So I think the key is, as we focus on serving the client, what are some of the critical needs of these clients, and if it's substance use and mental health, should that be the priority over other services? So that's something that we have to then take into account. One thing that we are very fortunate is that we work very closely with probation, parole, and the sheriff to see if the requirements are for the clients to be in treatment, then that should be our primary focus, because if they're not in treatment, then they may be violated and then go back into custody. So that's something that we need to take account in terms of how many individuals have that requirement, and are we meeting the demand. And again, to echo Chad's perspective in terms of staffing shortage, mental health and substance use providers are also facing the staffing shortage. So even if we have all the funding allocated to providers, they need to hire and open up facilities in the county.
Good. Thank you, Patricia.
Thank you, Supervisor. I think Mr. Aguirre's final comment in response to Ms. Perez-McDonald's question actually answered my question about mental health treatment and staffing shortages. Thank you.
And then I do know that Supervisor Wasserman loves these charts, so we provided you with a large infographic that encompasses all the highlights of our report. So.
You're saying large because of my age? Is that where we're going? Is that where we're going, Javier?
No.
Is that where we're going? I'm going to talk to Chad. I'm not going to talk to you. So, Chad, on the rapid rehousing on your PowerPoint presentation, where's the easiest place for me to find how many people were actually housed?
On the chart, it does have the number of housed versus capacity. I don't know if we can get it back up, but it's the green bar, I believe, on the chart. So, are you looking for just overall since the program's inception? I believe they report that on the Hewlett Committee, and Office of Supportive Housing does keep that information. So we can definitely provide it. We can work with them to provide a longer.
So I can get that from Key?
I believe.
Office of Supportive Housing?
Right. So at Hewlett, they do more of a expansive report on the reentry programming. So we'll just make sure you get that report.
Okay, and I'm specifically interested in the ones who went to the reentry center who ended up being housed.
So we will follow up with Key to identify those clients.
Wonderful. Thank you very much. And seeing no other committee lights on, Supervisor will consider this report received as well? No, Molly? Oh, you don't? Okay. There's your lights on.
Sorry. Thank you, Chad and Javier, for the report about all the excellent work being done at the Reentry Center. And I wanted to call out our expungement work in particular. Thank you again for the housing of our office there. We managed to get 1,800 records cleared last year, which is a huge number. It's 300 more than we did the year before, but we continue to, and those expungements are really important for the reasons these guys were just outlining. It's a barrier to employment if you have a record that has not been cleared. So we are very interested in doing more record clearance work, but there's a limit on the number we're able to file with the court, and I'm hopeful that we can work together to come up with some creative ways to use judicial resources to get more of those cases filed and heard.
Want to respond there?
Yes.
Please.
It's not so much judicial resources as staff resources. And yes, we're on it. We're creative, and we're working together. And again, my duties as a statewide chair of the presiding judges, I'm always so glad to come back to Santa Clara County because we have such great support from the county. And I think that with that support, notwithstanding state funding for the courts in general, I think we'll be able to make some good progress in that area.
Thank you. And Javier, Chad, Natalie, everybody that's involved with this program, all the people that work with you to provide all the support, the staffing. As the judge said in her role as chair, president of the State Presiding Judge Association Group, she's able to compare what other counties are doing. And so she's got more of a bird's eye view. You've heard from individual committee members here. You know how I feel about what you've done every year that I've been associated with you. So thank you on behalf of this entire committee for your fabulous work, all of you and everybody that helps you do what you're doing. With that, we'll move on to item number 9, which is our final agenda item of the day. And this is the 2017 Juvenile Justice Annual Report. Jermaine?
Yeah, the subject is our 2017 Justice Annual Report. And from probation, we have here Dr. Holly Childs. She's our Director of Research and Development, and Morena Cruz. She's our Senior Management Analyst that will be presenting the presentation today.
Thank you. And Dr. Holly, welcome. Haven't seen you since Monday.
Sorry, just setting up there. So, good afternoon, Chair Wasserman. It has been a long time since I've seen you last. And hello, everyone on the committee. My name is Holly Child. I am the Director of the Research and Development Department with Probation.
You've got a microphone button down there. You got it.
Oh, there it goes. Now it is.
Thank you.
And we're here today just to provide a short presentation on the full report, the Juvenile Justice Annual Report that you'll find in your agenda packets. And so we appreciate your time as we give you this little synopsis of the larger report. And so first and foremost, I want to just lay the groundwork is that probation prepares the report, but it's by no means a probation-only report. This is such a wonderful collaboration of public and safety justice and other stakeholders that work with our clients on the juvenile side. And it's one of those great examples of when we all come together and we have discussions, a lot of things manifest from that. So we produce this report, but sometimes in the process of producing this report, we find a lot of ways for system improvement and communication. So it's a great exercise in and of itself. So we're really excited to talk about the information we're finding today. So for those of you, especially in the audience, who maybe don't have a history of this report, we've been presenting for quite a few number of years now. It is a collaborative function from partners all over the county. So for example, we will get data from the district attorney's office, from behavioral health, from different Department of Education. We get data from many partners, and we compile that into a report that is really intended to give you kind of an overall snapshot of the juvenile justice system. So to start with the trends of system involvement, this is looking at the number of youth. This is a duplicated count, so kids perhaps may have come in and out of the system more than one time in any given calendar year. And so from 2013 to 2017, this is just showing you the number of duplicated youth per year. And as you see, 2016 was historically an extremely low year for youth involved in the system, and in 2017 we did see an increase. In general, what we're seeing is that of the approximately 3,800 youth that are arrested or receive a citation, 46% of those are diverted, and we'll talk about that in a moment. Of those youth that are arrested, 1,147 of them are brought to juvenile hall, and that's only about 30% of all youth who are arrested or receive a citation actually come to juvenile hall. And we detain about 88% of those youth who arrive at juvenile hall. Of those youth who have received an arrest or have been arrested or received a citation, 37% of those are petitioned in the court. And we don't right now have an efficient way to present petitions or how many are sustained petitions, but hopefully in our next report next year, we'll be able to provide that information. So kind of digging a little bit deeper down into the arrests and citations of youth in the juvenile justice system, 35% of youth are referred to our prevention and early intervention programs. And for those of you, we also we prepare a report for the Juvenile Justice Crime Prevention Act funds, and in the calendar year 2017, PEI had a recidivism rate of 1.4. So the kids that we're diverting into that program are, for the most part, being very successful, and so we're very proud as a system of that accomplishment. 11% also participated in the DRP program, and as you can see, most youth are arrested for property crimes, and 19% are arrested or receive a citation for what we call other crimes. That can be a traffic citation, that can be obstruction, that can be resisting arrest. So it kind of encompasses a little bit of a range of offenses. And the third most common is felony crimes against people. One of the things that we really wanted to do and highlight in this presentation is to talk about disparities. And so as you can see, Black youth are 7 times more likely to be arrested, and Latino youth are 3 times more likely to be arrested. And there's a lot of good work going on in the county with a lot of the partners on really looking at that disparity and how we might impact those numbers and do a better job. We thought it was really important to show the geographic distribution of where kids who are arrested or receive a citation reside. And so what we've done is we've done a little something differently in this presentation than we have in the past, is we separated out felonies and misdemeanors to give you a general idea of where those kids are for the kind of larger grouping of offenses. So the columns that you see in the top that are in blue, those are felony offenses. Again, those are duplicated numbers, so youth might fall into that more than one time. And the zip codes that you're seeing the most in there are Valley Palms, Mayfair, and Seven Trees. So we circled that in blue to kind of give you an idea. When we look at misdemeanors, status infractions, what we see is a little bit of a change. We see the largest number of youth come from Gilroy. And so again, we're really having discussions about why we're seeing kind of that geographic difference between felonies and more minor crimes, and having discussions about how we might also do a better job of ensuring that there's no disparities based upon geographic location. And now I'm going to turn it over to my colleague, Marina.
So now we want to talk a little bit about the risks and needs that these kids have. So for this, we actually use our JACE, which is the Juvenile Assessment and Intervention System. This is actually a tool that is gender specific, and it's also a validated tool. So I'm just going to touch a little bit on all of these different areas as to what issues these kids are facing. So some of the things that we're seeing is that 32% of these kids they tend to be between 14 and 15 years old. When it comes to parental supervision, girls are reporting that they have less supervision at home, and that's 41% compared to boys, that's 29%. In terms of child abuse and neglect, we're looking at 55% of these kids have had a referral when they are actually the alleged victim of child welfare, so that means that they have gone to a different system prior to coming into probation. For education, boys are actually having a harder time at school, 35% compared to girls, 25%. And then when we're looking at criminogenic needs, boys are actually scoring higher than girls. 2 things that they were kind of, when you're looking at these numbers and they kind of tell you the story of what's happening, it's in terms of behavioral health. So we're looking at 30% of girls have attempted or thought about committing suicide at one point or another. And we also, thank you, and we also look at 70% of girls and 62% of boys had a significant issues either dealing with depression, anxiety, or other emotional issues. So that kind of gives us an idea of what these kids are facing when they're coming into our system. So this line here is looking at the kids that are actually brought to juvenile hall and that they're detained or that they're released. So this is a 5-year trend, and like Holly said, 2016 were lower numbers, but something that I do want to let everyone know is that for 2016 and 2017, the detention rate was actually 88% for both years. And that was actually higher from what it used to be in 2013 through 2015, which was about 81 to 82%. So even though the numbers are lower, the actual detention rate remained the same. In terms of the detentions, again, this line, it's something that we kind of touched a little bit earlier, but we had a total of 1,147 youth who were arrested. From that, we had 1,013 youth who were actually detained, and 879 youth, or 77% of those kids that they were brought to the hall, they were actually there, till their detention hearing. In terms of disparity, when it comes to the detentions, we see that Black and Latino youth were 13 and 6 times more likely than white youth to be detained. So again, that's an issue that we see across from all systems in terms of when they're coming in and what's happening to those cases. So this is petitions. This data, it's actually data that we work really closely with the DA's office in terms of, trying to ensure that we have accurate numbers. So from what we're reporting here, we had 1,390 petitions filed in 2017. That was a 16% increase from numbers from the previous year. And the most frequent reasons for those petitions being filed were car theft, and I have actually percentages here for you, but car theft was 22%, residential burglary was 21%, and robbery was 16%. And then you have the chart on the side that it looks at the last 5 years trend as to how many petitions were filed each year. And all of these numbers are on duplicated counts. For disparity, again, we have the same issue. Black and Latino youth were 11 and 5 times more likely than white youth to be petitioned for one of those arrests. So lastly, something that we did this year, we kind of wanted to take a deeper dive into looking at specific programs. So for this year, one of those programs was Wrap Around. For those of you who may not know about Wrap Around, it's a service where the youth is put at the center. So the biggest thing about that is trying to elevate the youth's voice so that they, the youth and the family, they can actually be active participants of what services they're identifying that they need. So we have 3 populations that we serve for that. So we have pre-adjudicated youth, adjudicated, and also ranch reentry. So if you look at the table on the side there, this is looking at recidivism just for those kids who participated in wraparound services from January through June 2017. So we had a total of 94 kids. From those kids, we have it broken down by the specific age. So for pre-adjudicated kids who were 14 and older, we had a recidivism rate of 36%. Those youth that they were below 13, they were 25%. And then ranch reentry, 27, and wards of the core was 43. Overall, that was a recidivism rate of 37%. And again, we just looked at the first 6 months because kids that they came in at the second half of the year, they didn't have enough time. By the time we pulled the data and we ran analysis to ensure that they have the same time frame to be able to calculate that outcome as well. And then lastly, I want to leave you with one of our success stories that we have for Wraparound. I'm sure that we have plenty of those, but one of the stories that I want to highlight here, it's about this kid who, growing up, they had experienced lots of issues. They had traumatic events. One of the parents had actually passed away due to an overdose. They were homeless. Mom was a single mom. She was trying to, had a couple of jobs trying to make ends meet, especially in our county. And so the wraparound team, they actually were able to work together with this family. They were able to get them into Section 8. Prior to that, they had to buy tents and just being able to provide some sort of stability. Something that the kid had actually said was, that having his own room was, great, and it just made him feel like he was having a normal life. And so it kind of puts it in perspective how we take some of those things for granted sometimes. And little by little, the family kept working together. He actually got back into mainstream high school. He was able to finish his high school there. So we see how those deep-end supports, sometimes they make the difference, and he was one of those kids.
Great, and we're happy to take any questions you might have.
Holly and Marina, thank you both very much. We have a speaker card on this item. Ms. Bassi?
I want to thank you both for a nice report. You did a really nice job. I lived in Gilroy for 25 years, and I'm very well aware of the crime. And one thing that I noticed that is missing from your report that simply is going to have to be discussed is the issue of education and the disparity of education in our county, which is one of the reasons that I moved to Los Gatos for the Los Gatos schools, because I saw what was coming for my children if I had left them in the Gilroy schools. And I fought long and hard to keep the Gilroy schools good for all the children because I know the difference that that makes. I want you guys to start investigating your reports as if you're an investigative reporter or a mom. And when you're talking about why all these people are getting put into the system and why these children are getting put into the system, to leave out the issue of the education and the disparity of education in our county, we are remiss in leaving that out. And to leave out what is happening, you mentioned a family, a child who's had the death of one parent. Every single day in our family courts, children are experiencing the death of one parent based on a judge's rulings. That's what happened to Deanne Powers, who tried to speak with you earlier. Judge Takeichi just simply removed her from her daughter's life. Her daughter is now dealing with mental health and other issues. Judge Takeichi is biased and is part of a culture. He is not friendly towards women. He doesn't recognize domestic violence, and he doesn't normally find any women credible at all. This is happening times 10 with the judges in our county. They are making parents be single parents, and this is having an effect on our children, and it is eventually winding them up in our criminal courts. We also, I spoke to you earlier through the Children's Committee, we are not doing a good job with enforcing child support, federal guideline child support, and DCSS is not being given the tools that they should be given. They're being given to our district attorney's office when they should go into Department of Child Support Services, and we should be looking at the whole child, not just when they get into our system. Thank you.
That concludes public comment portion on item number 9. Wally.
Thank you, and thank you for that great report. I just had a quick question about what school inadequacy is. It's mentioned on packet page 89.
Sure.
So we're looking at issues where the kid is not going to school, they're having truancy issues, or they have special needs that they're just not being met by the school. So there could be issues like an IEP in place or something of that nature.
Supervisor? Oh, Sylvia.
Yes, thank you. Great report. It was a really great read and very in-depth and detailed, which was really wonderful. In your summary in today's meeting, you didn't mention, but it is in your detailed report, the admission to custody of children and the process and assessment that is done, including the use of an objective risk assessment tool. And I found your discussion about the override particularly interesting. It's my understanding, at least, that there's a statewide recommendation of the overrides to be 10%, and your report indicates that there's an 81% override rate, which means, based on what I read, that even youth that are scored on the low to medium risk, there's reasons why there's an override and they're detained anyway. And I know that there's reasons to do that, but in terms of listing the number of exceptions for why youth are being detained, it seemed a little high to me. So I wanted to see if there was some information that you can provide to the committee and enlighten us on what that is.
Great. I mean, that's an excellent question, and I think looking back at kind of how it's worded, it may not necessarily be clear. There's about 21% of cases that are actually discretionary overrides, so we are still slightly over the amount that you're quoting. And we are currently in the middle of doing a study of all of our overrides and basically all of our decision making and doing a revalidation of our tool. So we're working on that. We are working in conjunction with all of our partners in addition. But I think of all of the youth who are brought to hall, there were about 212 that had a discretionary override. And some of those were for either public safety or self-safety of the youth. So we have been taking a look at those, and we haven't seen anything in the first kind of review that was kind of alarming. It's probably more of a paperwork process that they're being coded that way rather than true discretion sometimes. So we're working on that in hopes that we'll be able to provide more detailed information in the next report. But it is a great question.
Yes, thank you. I appreciate the answer. I did note, though, that in the discretionary override, so there were 221 kids that were detained, meaning that the screening officer, even though the tool said release, they detained them anyway. And 81 of those were for public safety, community safety, self-harm. But technically, the tool should include a consideration and a factor for that, right?
Mm-hmm.
So, and then there were various other exceptions, including one that I found interesting, which was basically all other reasons. And it didn't provide an explanation for why the youth was really detained. It was just kind of a catch-all for whatever reason. So I appreciate the fact that there's going to be an analysis of the tool, because otherwise, again, you did a wonderful job in noting the issue of disproportionality. And if this, our system is meant to make this system more objective so that we're not disproportionately detaining youth of color, and then we're not using this tool in the appropriate way, that's why I'm raising the issue.
No, it's an excellent point, and we concur. So hopefully we'll be able to have more information for you in the near future.
Very good. Thank you so much.
Thank you. And I'll conclude this final agenda item with a question of my own. On package page 105, if you can look at that third bullet from the bottom, it says regarding placements from dispositions, it says the overall number of out-of-home placements increased by 22% and ranch commitments increased by 104% from 2016 to 17. Wondered what you might attribute that to.
Oh, yeah. So most of it, to be honest with you, is kind of numbers. We did have a lot more youth in 2017. So when we're looking at percentages,
So a population growth.
there is a little bit of a population growth. So we do have a larger percentage of higher risk kids. So it has added that. In addition, we have had a larger number of youth with child welfare involvement. So there have been some cases where there have been out-of-home placements where we have, for example, kids who are dually involved or kids involved in our wraparound. And we continue to see kind of a slight increase in those youth who are involved in dual systems. So I think we are seeing more youth with more complex needs.
So you might project a leveling off in subsequent years?
So I think actually another point, because I think you're concerned maybe with the 104% increase at the ranch, perhaps. And what we have also seen is that this was the same time period that Prop 57 was passed, and many cases came back from the adult criminal court process and were now being processed through the juvenile court, and those youth are either going to the ranch or to DJJ. So we have been sort of keeping an eye on this trend, because we do see an increase of both higher risk youth at the ranch and more youth going to DJJ instead of being going through the adult court process. So all of those things, I do believe there will be a leveling off, because we had a whole bunch of cases that came back. However, we will continue to see some sustained increase just because we're now handling more cases at the juvenile level.
Okay, and if more court cases are being diverted to the juvenile level, then logic says they're being not handled at this level, so maybe that other, where they came from, went down and a leveling out. Super, thank you. Supervisor, that does it for me. Does that do it for you? It does. Committee members, thank you for the motion to approve. I'll second that. So that's received. And Molly.
Thank you. I just wanted to make a comment I've already made at JJSC and at the Mayor's Gang Prevention Task Force related to the 2013 to 2017 numbers, because there was quite a bit of discussion in the press and at a lot of these meetings about juvenile crime uptick, which if you look at 2016, which had a historically very low arrest, petition, detention rate, and 2017, it looks like 2017 spiked up 30% or something. But if you look at 2013 to 2017, it goes steadily down across all of the categories they were just describing, and it's really important to sort of counter-narrative what's been being said in the press about an uptick in juvenile crime, to look across the whole span of those years, because it does reflect all the good work being done in this county by all of the system partners.
Thank you for that clarification. And I'll conclude by saying this meeting is adjourned. We're going to reconvene here in these chambers at 2 p.m. on October 17th. Thank you all very much.